Hey there, it's Dr. Robert Ciprian. I wanted to do a little video to talk to you guys about just general basic chiropractic practice, the way that I practice it. I've been doing chiropractic for over 20 years, and I use it with applied kinesiology. So applied kinesiology is a study of muscle movements. We use muscle testing to kind of decide what are the best courses to take with the chiropractic treatment. So what chiropractic is, it's the realigning of joints in the body that are out of place. Now, sometimes people have pain in their neck or their back, or maybe shoulders, hip, feet, wrist, whatever, any joint in the body. They have pain in their body because a joint has become out of place. And when the joint's out of place, the muscles around there can't function correctly anymore. The bones aren't lined up properly. It's going to affect the function of the vascular system, the blood flow around there, the lymphatic system, the nerve function too. So the muscles around there can't turn on and off properly to keep the joint in place and move it as it should move in a nice smooth direction. And also the acupuncture meridians, which are the energies that flow around those areas or through those joints, those won't be working right either. So as a chiropractor, what I've been trained to do is to assess where a joint is out of place and learn how to put it back specifically right where it needs to go. There's many different forms of chiropractic. I've studied a lot of different ones, and I taper the treatment for each individual patient according to what they need. So my treatment's not a one size fit all. I'll assess someone and kind of figure out what they need for their body, depending on why they have their pain or dysfunction or whatever's going on there. And also, if things are out of place, can cause other issues too, like headaches, digestive problems, sometimes anxiety, depression, um, insomnia. All these different things can also happen when you have this extra tension in your body that's also disturbing your internal function of your body. So I was talking about applied kinesiology. I use that to assess people for chiropractic. So what we do is we look at the posture of a person and see how it looks. Also, we examine how a person walks or maybe does other movements like moving a shoulder or maybe just getting up from a chair. And from there, we can see what muscles are working properly and which ones are not. And a lot of times there's just joint misalignments that are causing the muscle not to fire properly. And there's many other reasons why the muscle might not be turning on or off correctly. So what I always do is I make sure the muscles around those joints are working properly and we get the joint line back up again. When it's done in this fashion and the muscles are balanced and turn on and off correctly as you're standing or sitting or bending or walking or moving, then the joints in the body stay in place much better. Some chiropractors have you come in like 3 times a week for 6 months and you do this whole big long plan. They just keep putting things back in place over and over and over and over again. Me, I see a person much less often in that because we'll get the muscles around the part of the body where the person's having the problem balanced and turning on and off as they should when they move that part of the body. So it keeps the joints in place more, whether that's part of your spine, neck or back or low back or pelvis or your upper extremities, your arm or your lower extremities, your hip, knee, feet, um, all these different joints. Any joint in the body can be worked on by chiropractic. We will get the muscles around those areas of the body with the applied kinesiology, which is a postgraduate degree I have, and also that I used to teach for about 14 years. And with that, the combination of applied kinesiology and chiropractic, my patients just been getting well very easily. Old chronic issues they have just resolve much quicker. Injuries, fresh injuries that people have heal much quicker than normal because we get everything lined up and functioning properly again. So the joint can heal faster because it's just working properly again. So if you have any questions about my approach with chiropractic or any questions in general about my practice, please contact me. Let me know. You can get in touch with me through my website, healprofoundly.com. This video has helped you out. Please like it and share it with anyone that you know that might need this. Thank you very much. Have a good day.